comfortable, okay? So, okay. First things first off the bat, can I just have you verify for me your name and date of birth? Perfect, okay. And I see here that you don't have any kind of medication or allergies to materials. Is that correct? Okay. Just want to make sure that I use gloves that aren't going to irritate you, and also that you're not going to have any kind of issues with the conductive gel that we use. So give me just a sec. Just need to get my program booted up. Sorry. Sometimes the hospital Wi-Fi can be a bit on the slower side. But okay. So first things first, is it looks like you're not wearing any earrings, okay? Do you have any eustachian tubes? Okay. Any cochlear implants? And do you use a hearing aid? Okay. So, before we get started with the ultrasound, I am going to do a brief exam, both internally and externally, of your ear, just to make sure that there's nothing that might contraindicate this procedure. And then we will get on with it. So, just take a peek here. And let me kick this wire out of the way. Sorry. Sometimes things get shifted as we clean up rooms between patients. Okay. Any irritation or discomfort with the otoscope? Okay. Just need to rule out any kind of infectious processes or openings in the skin. Any kind of issues with the eardrum or the internal structure of the ear. But everything looks good, at least on that side. So I'm gonna go ahead. Oops, I'm sorry. Gonna go ahead and check the other side now. So how's this side feeling? Any pain or discomfort here? At any point that changes, please don't hesitate to let me know. And I'm just going to use my light to take a look at the external ear. Because it's not uncommon for people to have breakouts. Given that the ears produce a pretty good amount of sebum. Not seeing anything that would be considered a contraindication, so I think we're okay to proceed. Okay, so I'm going to start by applying our transmission gel, okay? And this has been heated, so it shouldn't be uncomfortable, just kind of goopy. I will make sure to clean you off when we are done, okay? So, I'm going to start on this side. I'm gonna apply some to your ear. Sorry about that. These bottles make some amazing sounds. It's okay. Then I'm going to stand up here. So, this should not be painful or uncomfortable, okay? It might be a little bit of pressure, but that should be the extent of it. Because as you can see, my transducer is quite blunt, so it shouldn't be digging in or anything like that. So, just to start, how's that pressure? Okay. there. Can you hear that? Tell me when you hear it get close. Good. Okay. Maybe kind of pressing on your head on this side for a second, just so I can get the leverage that I need. constant reach because it is wireless. Tell me when you hear my fingers get close. Good. And again. Alright, so going to do a quick test here, which is called an nystagmus test, where I'm going to be turning your head while watching your eyes to look for any kind of flickering, which we call nystagmus, which would occur if you're feeling off balance, and that would indicate that there is still fluid remaining in the ears deep within. Although it's not the only diagnostic tool we have, but it is a pretty good one. So, you ready? Okay. I'm gonna start with smaller movements. And then gradually get bigger as we go. Okay. I'm not seeing anything, which is good. Another peek inside your ears. Any change, any new tenderness or anything? Okay. Alright. That side looked okay. Check the other one. How about with this side? Any new tenderness or anything? Okay. Well, I'm not able to visualize any changes. I'm going to take a quick peek in your nose to check for any drainage. So, okay. Okay. And can I have you open for me? Great, thank you. Alright. Not seeing anything in your throat either. Do you feel like anything might be draining or any kind of new scratchiness or anything? Okay. Well, that's good. Okay. So I'm going to send today's results to your primary care and referring physician. Would you like to have a copy for your own records? So on your way out, we'll just need you to sign a release form that gives us permission to release them to you. I know, it's the law though. And it's a good thing that's in place. The Privacy Act protects us from a lot of potential bad. So, okay. The ultrasound should have provided some relief. If that is not the case and you notice in a couple of hours you're feeling that dizziness again, that ear pressure and pain, make sure you let your doctor know, okay? I did send off the images that I took so that way they can interpret them and perhaps come up with a diagnosis. And we can also forward them to any imaging places that you might see subsequently as well. Okay. So, you are all done here. Do you have any questions for me? Okay. Well then, if you're ready, I can go ahead and walk you out, okay?